Hello everyone, today's video is about expecting a baby during the COVID pandemic. And I wanted to video outside today as a part of the message of it's going to be okay. Try to relax and try to do all the self-care things you can before this baby arrives. So there are a few changes in the normal routine for deliveries just due to COVID, but not a ton of them either. So many of the same things we would have said to you if you were expecting a baby even pre-COVID still apply today. All of them really, except for the few specifics we'll cover. You still need to purchase a high quality, never used before car seat and have it carefully installed in the middle of the back seat rear facing. You still need to be aware to avoid all sick people and really all crowds and big groups of people and family reunions for at least the first 2 months of the baby's life. So that still applies now even during COVID. The major things that we've seen change are everyone's more stressed and there are higher levels of anxiety. Now this matters a lot because many moms unfortunately have to deal with some postpartum anxiety and depression. And so if you are going into the delivery already with a fair bit of anxiety or depression, make sure that your OB knows, because that matters a lot. And the lack of opportunities for social events and support from large group of friends could make that even worse. So it's important that you're aware of that. It's a very real thing. It doesn't mean that you'll have it, but if you're already struggling, just make sure your OB is aware, because there are medicines that you can take to help, as well, of course, as counseling, that your OB can prescribe that are safe to take even while you're breastfeeding. So I don't ever want moms to think that they have to choose between feeling happy and healthy and using their necessary medications and choose between that and breastfeeding. There are medicines that are safe. So the specifics that would be different though in this current pandemic are that some hospitals are testing the moms before a planned admission. So in other words, if you have a scheduled induction or if you have a scheduled C-section, many hospitals are testing for COVID prior to admission so that they would know how best to isolate you. And most of them are recommending that, of course, the mom only bring one partner or support person, and then the baby and the support person and the mom have to stay in that same room pretty much the whole stay. So a lot of moms are going home much earlier now because of some of these restrictions. And I have seen a lot of newborns lately that were really on the way we counted on the chart, they were day of life 2 when I saw them in the office for their first office visit. And that's a really fast discharge. That means they got discharged the day before I saw them at just 24 hours of life. Then I'm seeing them at 48 hours of life. That's a pretty quick trip out of the hospital. So please remember, if you are not ready or confident to go home with that newborn, make sure your nurse and your providers know that before they discharge you from the hospital. One of those cases was a C-section, and I had never seen one discharge that quickly. I mean, everybody's getting discharged quickly these days, but good gracious, please stay in the hospital long enough to feel comfortable with your own care and the baby's care by the time you go home. Some of these stays are just incredibly short. Well, let's say you did get swabbed prior to a scheduled admission, and then the test came back positive. Much to your surprise, you may have been asymptomatic. You may understand that part of why this pandemic has been so aggravating for everybody is that people who do not realize they're infected or sick could still be spreading the virus, which is the whole reason that everyone should wear a mask, so that we couldn't accidentally spread even though we were asymptomatic. Well, because of that, some moms have had a very unpleasant surprise of a positive test. So if that happens, if your pediatrician has a newborn baby whose parent tested positive, or the mom specifically, there are, at least in our area, and I'm sure this is similar across the country, there are specified respiratory clinics that do newborn care of known positive moms until the mom is healthy or it's been greater than 14 days since the positive test, since she was already asymptomatic or tested negative. So they have specific criteria at which point the baby is then cleared to follow up in the regular pediatrician's office. So even in our office during COVID, since you'll be coming in pretty frequently at the very beginning for weight checks, it is important that when possible, you minimize the total number of people in the room. So obviously with a newborn, it is perfectly great for both parents to come. They often need to hear the reassurance or hear the directions and instructions and follow-up care and all of those things. But it's really not suggested that you have the baby, both parents, and 3 or 4 siblings, because that's just a lot of increased contact with potential respiratory pathogens, and we're just trying to minimize the total number of people in the office. Now obviously the office where I work and many others across the country are doing creative things to make your visit to the office indoors very safe. We, for instance, see all sick patients, fevers, respiratory symptoms outdoors in a drive-through clinic. So be reassured that your pediatrician's office is safe, and many measures are being taken to preserve that safety during this COVID crisis. So the COVID crisis really should not change at all your follow-up plans, we hope you breastfeed, your breastfeeding plans, meeting with the lactation consultant, all the things that we talked about on the other videos for baby care. COVID really shouldn't impact that. In fact, it might actually help you. Think about this. A lot of moms, especially new moms, go home and they're exhausted. Maybe they have an epidural headache. Maybe they had a C-section with a huge incision that needs to heal. Their nipples may be sore from breastfeeding. They may feel engorged from their milk coming in. The baby's going to be awake more at night than during the day, so you're just exhausted in every way that you can be exhausted, physically, mentally, emotionally. So having a host of company during the day really doesn't help you out very much. So if the COVID crisis could maybe cut down on excessive company, that wouldn't be such a bad thing. And we've always cautioned you against large crowds till 2 months anyway. So as far as that goes, it really doesn't change our recommendation to you or our anticipatory guidance to you. So use it to your advantage to really emphasize we may only have 1 or 2 visitors who are healthy, who wear their masks the entire time they visit, who are vaccinated, who wash their hands carefully before holding the baby. So we really do need to be extra cautious right now about excessive company and visitors. But remember, that's really to your advantage if they were preventing you from taking some daytime naps that are sort of a survival essential trick that you need to adopt for now until the baby's older and gets a sleep-wake cycle more onto the normal day-night plan that we so enjoy. So I hope this was helpful for you guys, and if you did find it helpful, please subscribe so you can see all those other baby videos, and I will try to do a video approximately once a week. And take care of yourself, make plans for that baby coming, get that nursery ready and all those little clothes washed, and pack your bags for the hospital. You do not typically need to let your pediatrician know who you've chosen, but you do need to let the hospital know when you go in so that the newborn screening will be sent to the proper pediatrician. Thanks.